Hello, this is Marshall Riddle from MCWell, welcoming Cora Tellez, President and CEO at Sterling HSA. Thank you for joining us, Cora.
Thank you very much, and I'm pleased and happy to be part of the Web Summit, and I appreciate your interest in HSAs. So this talk will discuss HSA trends from the perspective of our company, Sterling HSA. This slide discusses a bit about our company, and I thought it would be helpful to the audience if you could know a bit about our organization. Sterling Health Services Administration, or Sterling HSA, is an independent account administrator for HSAs, HRAs, FSAs, and COBRA since 2004. We're a privately held company, financially self-sustaining, and we're very proud to be in this business. What makes us different from others is enormous attention to sterling service, very high-touch, high-tech customer service. There are very few organizations in our space, for example, that actively reviews and pays medical bills on behalf of our HSA clients. As a sense of our size, we have $75 million of assets under management, and the vast majority of the people who work at Sterling have had deep and strong experience in the health insurance industry. So that's the introduction about Sterling HSA, and I want to move on to the next slide. What I want to do in this presentation is to really talk about HSA trends from the viewpoint of our clients. And I want to focus on a particular client group that we have been watching with great interest since they began with us in 2005. And that's because they were our first collectively bargained group to join an HSA program. On this next slide is a chart that looks at the individual ending balance at various year ends, as you can see. And the headline news here is that the account balance continues to grow despite tough economic times. If you look at 2010, for example, the average ending balance for all of Sterling's HSA account holder is $2,406, an increase of 21% over December 2009. I thought that was actually striking because my hypothesis is that with very tough times, people would draw down their savings, and they certainly did that, or use more of it to, frankly, close accounts because they've been laid off and they need cash to meet whatever financial obligations that they have. And some number, frankly, occurred in 2010 at Sterling, and I assume in other parts of and with other administrators. And yet I was just really struck by how much the concept of savings for your health now and in the future has really gotten hold in the thinking of our clients. And so I was very pleased to see this, that an increase over 2009 in one of the toughest recessions our country has ever faced. I now want to move on to the next slide. This slide discusses a collectively bargained group's experience. So they represent, this group, about 5 employers affiliated with the Northern California Teamsters Trust. They were enrolled in 2005, a year after the HSA law was created. So this was interesting because these 5 employers, all represented by this Teamsters Trust Fund, were really facing very difficult economic times. And in 2005, they had the terrible choice of not offering health insurance at all because the premiums had risen so much. And these are all self-funded groups. So a very enterprising broker said, we've got a different solution for you. We want to install an HSA-compatible insurance plan, but you will need to make the employees comfortable because this is a very big jump for them. They were going from an HMO, a very rich plan, to a high-deductible PPO plan. And so the employers agreed to fund $1,000 to every employee's HSA account. And you'll see that in 2005, 56% of them actually withdrew funds to pay for medical care, which also says something to you, which is some number didn't touch their funds at all and used it as a savings vehicle. Go forward 5 years in 2010, 43% are using their HSA monies to pay for medical care. So a growing percentage not using it at all to pay for medical care. Or it's possible that certain needs were satisfied earlier, such as orthodontia. We saw a lot of orthodontia, and or other medical needs. You'll see the average ending balance in 2005, $440. Remember I said that the employer funded $1,000? Some of our clients put their own money into the account, but the vast majority of them did not. They are working families, so it's perfectly understandable. So $440 ending balance in 2005. And look at what it is today in 2010, $2,400, a significant increase over the 5-year period. What it tells me, and what I'm really gratified to learn, is that working families figure out HSAs pretty fast, that they now have an incentive to look at healthcare services in a very cost-conscious manner, because any monies that they don't spend get retained by them, and the savings grow year over year. So look at that, $2,400 in 2010. That may not seem a lot to a lot of people, but to working families, that's a pretty significant opportunity to save for the future. Let me now move on to the next slide. Here is the account holder activity on average from 2005 to 2009. We haven't totally closed 2010, which is why we've got 05 to 09 here. You'll see the contribution, average contribution. We began, you remember, with $1,000 in 05 because that was the promise by the employer. You'll see that in subsequent years the employer continued to put $1,000, but what you see here is would be contributions from individual account holders. And you will see it took a dip in 08 because it was the beginning of the recession in 08, and it's beginning to climb up again in 09. We're always curious about disbursements. How many times are people asking for funds to be paid out of their either the debit card or a check cut to the provider or to themselves? And as you can see, this doesn't change all that much, about 4.98 in 2009. But look at the amount of disbursements. You would think if you had all of that money that the employer is putting in $1,000 that people in general would rush to use it up, and that's not the case. So you could see here the fairly steady expenditure of funds on average. Again, look at the use of funds. Percent who used it in 05 was 56%, and it's now down to 42.79 in 09. And again, you can see the ending balance here that I previously discussed. So this is an interesting story to me. The slide says that the employer and the employee make continuously contributions to their HSA accounts, that you don't see really huge swings in disbursements, either the volume or the amount that's disbursed. And in fact, it looks as though there's an interesting trend that in most cases our clients, our Teamster, are using this vehicle now as a savings opportunity. So what was happening with medical spend during that time period? Look at the next slide, and this is frankly the slide that's my favorite because it tells a very powerful story. This is a slide that compares the medical spend, that is how much did people spend on average per employee per month for those people enrolled in a high deductible plan versus a similar group of people still run by the Teamsters who stayed with a PPO or HMO plan. Look at this data. This is medical per employee per month. If you were enrolled in a high deductible HSA plan, your average spend was $492. But look at a PPO and HMO. You would spend about 75% more, $861. That's a huge swing. And I will tell you, because we review medical bills, that people were not withholding care, because you would then have seen acuity of illness go up. What we did see is a reduction in ER visits, which I thought was interesting, and some reduction in specialist visits. So again, what it tells me is that given financial incentives, correct financial incentives, working people are pretty good decision makers about the health for themselves and their families. And they're asking more and more questions about cost-effective equivalence of the procedure or the drug that's recommended to them by their doctor. Speaking of drugs, look at this next line. It just is amazing to me. The difference in cost, PEPM, per employee per month for a person enrolled with a high deductible plan is $25 versus $127 for a PPO HMO. That's almost, 400% increase difference between the HSA plan and the PPO HMO plan. So what's happening there? What we've noticed is a significant increase in generic drug utilization, more use of mail order drugs versus brand drugs. And that, I think, tells me, again, that people can be trusted, average working folks can be trusted to make pretty darn good decisions. We spend a lot of time educating consumers, and I think over time this part of the industry will probably grow. The tools that are available on the web now for employees to compare the cost and quality by procedure, even the cost of a drug within a 30-mile radius of their home. Some of these tools now are becoming more and more available on the website, and I couldn't be happier. So that is sort of the end story. This really is the summary of the slides here that I want to talk about. One, I'm feeling terrific that despite very difficult economic times, HSA accounts continue to grow, that in fact the average ending balance increases even though there's every opportunity for people to take more money out because of tough times. And again, an affirmation to me that average working people, average families can be trusted to make darn good medical decisions on a cost-quality basis when given the right incentives and, as importantly, the right tools. And that's the story behind the Teamsters. They've been with us since 2005, and I am just tickled pink by the results that I'm seeing. And, of course, the employers are happy to boot, and so are the Teamsters Trust, because the less money that's spent on health benefits, obviously the greater opportunity to spend on other things that are just as important to the employee workforce. So I hope this was of value to you. If you have any questions at all about this presentation, feel free to call me. The next slide gives you the contact information. This is the 800-617-4729 office number, and my direct extension is 222. And the email address is cora.tellez@sterlinghsa.com. Thanks again for your interest. This concludes my part of the seminar.
Thanks again, Cora. This presentation is complete.